So I'm Simon, I'm one of the founders of Klara. At Klara, we believe that everything which can go online will go online. Basically, if you look back, books went online, retail went online, now food is online, going online like crazy, and the same is happening in medicine. Everything which can go online in medicine will go online, which means that people are not going to be operated online, but maybe by robots, but everything which is possible to go online in medicine will go online. I think you get the point. So at Klara, we believe that in the 21st century, patients will consume healthcare online. Patients will be directly and continuously be connected to their doctors through a digital service. And Klara is going to be that service. So let's take a step back. If you think about it, the patient journey of a patient thinking about he's ill until he's healed, there are a lot of really awesome companies and billion-dollar companies being built right now as we speak. So we start with the companies which are now actually offering online visits. We call them B2c Telemedicine Providers, like Doctor on Demand, Teladoc is just filing for IPO, Spruce, HealthTap, and other amazing companies who basically want to avoid the in-person visit. There were about 1 million televisits last year in the US only. But talking about a little bit more interesting market, which is the actual physical visit at the doctor. And last year in the US alone, there were 1.5 billion doctor visits, patients going to the doctor physically. If we look at this patient journey, we have companies like WebMD who's focusing on giving amazing information to patients when they think they're ill or want to be informed about a disease. You have companies like ZocDoc or DocPlanner who make it really easy for patients to book an appointment at the appropriate doctor. Then once you're in the doctor's office, there are amazing companies like EMR, electronic medical record companies, or patient management software companies like Modernizing Medicine or Epic. Epic just alone does $1.5 billion in revenue a year. Klara wants to go piggyback on these 1.5 billion doctor visits a year in the US and is clearly positioned after the doctor visit. So what Klara does is, Klara is a software that enables doctors to build their online network with their patients to provide remote, asynchronous premium care in a smart and very simple way. So let me show you how it works. If you're in the in-person visit at the doctor can easily invite you through Klara with one click. Let's say I go to the dermatologist and the dermatologist tells me, Simon, you have to come back in 2 weeks, which actually is the case in about 50 to 60% of all dermatological visits right now. So he's saying you have to come back in 2 weeks, but you don't have to take a day off, you don't have to commute, you don't have to find a parking spot, you don't have to sit in my stupid waiting room, but you just see me online on Klara, I'm going to invite you and you connect with me. So the doctor easily invites the patient gets a text message, and for security an email, just clicks on the link, signs up, and right there he's connected securely to the doctor. From that moment on, there's a secure channel between doctor and patient where the doctor can exchange important information, can see the patient online, can send him messages, and can send him messages with attachments. So we believe that healthcare is not the sum of your visits. It's actually an ongoing conversation between patients and their doctors. This is why we decided from a product perspective to focus on the basic means of communication, which is messaging. So our application is a messaging application where you can exchange messages, and these messages have attachments. These attachments can be just text, can be photos, can be PDFs, like treatment plans, lab results, but can also, starting last week, be e-prescriptions. So the doctor is able to e-prescribe drugs through Klara directly, which the patient can then pick up in the pharmacy of his choice. The doctor can also send bills and payment requests. So there's a payment request in Klara, and the patient is able to pay the bills right through Klara. Naturally, we have our application on all platforms. We have native apps for iOS and Android, and we have mobile web and desktop web. We decided to focus on one market, which is the US now, and on one area of medicine, which is dermatology, because that's the first area where more than 50% of all doctor visits are going to go online in the next coming years. The reasons are that 90% of all skin diseases can be diagnosed via a photo. But more importantly, 70% of these 90% can actually be treated without the patient seeing the doctor in person. meaning in 30 to 40%, the doctor needs to cut things out, take a urine sample, take a blood test, but in about 70%, it's just a visual diagnosis to tell them, okay, take this cream, take this drug, etc. Another good factor about dermatology is that 50% of all visits are follow-up visits, and 30% are chronic patients, which are coming back to the doctor's office up to 10 times a year. So perfect to start in before moving to other fields. What makes Klara unique is that we are capitalizing on the existing doctor-patient relationship. We want to create a meaningful and sustainable network between the doctor and its patients. We see medicine as being a network, a hierarchical top-down network, where the doctor is the multiplier and the node who's able to tell the patient what treatment they get, what toothbrush they are using, but also what technology they are using. That's why we are focusing on the doctor, bringing our software to the patients. Just like LinkedIn or Facebook are based on existing real-life relationships, we do the same. And the relationship of a doctor and a patient is formed in the office. So to make this clear and to differentiate ourselves from other services like the B2C services, where we spent quite some time last year, like Doctor on Demand and Spruce, HealthTap, and Teladoc, they are building virtual online clinics. Customer acquisition is pretty high. Customer lifetime value is pretty low because people are not really coming back. They are one-off shoppers there. So the question about defensibility has been asked. With what we are building, Klara is building doctor-patient networks, so the doctor acts as the trust carrier, the multiplier in the network, and can bring our service to potentially thousands of patients, where we then have a pretty low patient acquisition cost and a high patient customer lifetime value due to the trust the doctor brings. So with Klara, we can produce defensibility through network and lock-in effects. So where are we now? We started our B2B product in the US about 5 months ago. We've onboarded over 100 doctors who are starting to build their online networks with their patients. And this is just the beginning. We are just at the beginning of something really big. In the next 6 years, we want to have 50,000 doctors treating more than 30 million patients, generating revenue for Klara of more than $100 million. So what's our business model? It's also very easy. It's $99 per month per doctor account. We could easily charge more, but we are currently working on a feature called collaboration, where doctors can actually collaborate with their staff and their assistants and their colleagues on patients, just like in the real practice. So doctors will end up having 3 to 5 accounts where they pay for. On top of this subscription fee, we are also charging a transaction fee. So if there is any transaction facilitated by the doctor to the patients through Klara, we take 10%. So how do we do that? We do that with our kick-ass teams, which we are building currently in the US. My co-founder is permanently living in New York, building up the team there with predominantly people coming from ZocDoc and companies where they really learn how to sell to doctors, because that's a big challenge. And the other thing is we have our amazing product team here in Berlin building the software. Last but not least, I want to point out our really renowned medical advisor. It's Mark Lebwohl. He's the president of the American Academy of Dermatology. Brian Berman is the coming vice president. Daniel Siegel, who's the former president, and Mark Kaufman, who's also on the board of directors of the American Academy of Dermatology. And he's the guy who's responsible for digital health. So why do I show this? Because we want to focus on having a very serious brand and be taken seriously as a player in one field before we are taking it to other fields like plastic surgery, aesthetics, and then to the general medicine practice itself. So together with these people, we are working on nothing else than changing how doctors see their patients and changing how patients see their doctors. And I'm going to show you a quick video to let you see how doctors use our product.
My biggest objective when a patient comes into my office is for me to address their needs. If they are concerned about a lesion on their body, I'd like to either provide reassurance or do the necessary tests. If they come in with a medical condition that's causing them distress, I want to get them a diagnosis and I want to get them treated. What Klara allows me to do is all of those things. A lot of the electronic systems that doctors are being forced to use are not user-friendly for the doctor, and Klara is very unique in that sense, in that it is. Dermatologists are not having to conform to its technology. We are very much in charge, in a sense, of making this technology work for us and work for the doctor, and therefore work for the patient. There's innumerable differences between your patients contacting you through Klara versus through email or text messages. The first of which is that Klara is a HIPAA-compliant company. Patients are able to send me their concerns with a photograph, with the poignant questions that I need answered. Everything is being documented effectively through Klara, so you don't have to worry. And then finally, you get paid for your work when you use Klara. It actually was really simple for me to start Klara in my practice. I really just started it one day and offered it to my patients, and they are loving it because here they are able to access me during times that are not necessarily convenient. It is incredibly easy just to integrate it into your day-to-day life of seeing patients. Or even in the evening, you can check in with Klara. It's not a stressful medium. You can check on your current patients, check on any new patients. I think that Klara is just an excellent platform for dermatologists because it is so user-friendly.
Thanks.